Okay, there we go. All right, please state your name and your position in the company, and you will have 15 minutes.
Good morning. I'm Volusia. I'm the Chief Executive Officer.
The microphones actually pull up, and you can speak into either or. So if you might want to leave that one tall, that one tall, and that one short to adjust for height.
I'm Ken Palumbo, Chief Operating Officer.
Angela Gehring, Senior Vice President of Clinical Operations.
Dr. Maria Brooks, Corporate Clinical Coordinator for Behavioral Health.
And Ryan Ahern, Director of Financial Operations.
I feel like the GM of the Magic when they got Shaq that year when we got first. So you go ahead and flip the slide, please. Very quickly, we've got 15 minutes. We're going to be just try to get to the point. 3 things hopefully you'll remember when Armor walks out of here is one is going to be quality. One word, quality. That's our focus. Quality we feel like leads to number 2, and that's cost savings. That's being financial stewards of the county's money. We're very sensitive to that. And 3, and you'll see in the handouts that it's a little bit more extensive than the overhead, but don't ask us, ask our clients. And I think you'll see a number of quotes. I know you're making a decision today, but I would encourage that. But we're very thankful to be here. Very quickly, a couple things I think that are unique about Armor. Number 1, we're a physician-owned company, solely owned a minority company. Dr. Jose Armas, we're Miami-based. And so I think we're quick on our feet. I know we're quick on our feet. Our focus is certainly going to be Florida. If big is what you're into, our sister company, MCCI, is a $1 billion company. It's totally independent of us, but we're not going to be the biggest. Like everybody else, I read newspaper articles. We're not going to have X number of accounts. We're going to want to be quick on our feet. We believe that's a success to be able to serve the clients. Accordingly, we're very disciplined in the sense that we're only going to add 3 or 4 accounts a year, period. As you can see, currently we're in 15 counties within Florida. We're in negotiations with Osceola County as we speak. That hopefully will go to the county in a week or 2. So Florida's home for us, number 1. Secondly, you'll see we're in another 6 or 7 states. We're not going to be expanding all across the U.S. That's not our business model. We have 1,100 employees within the state of Florida. We have a total of roughly 2,200, and I feel frankly very blessed to be with this group here today. First is quality.
This slide demonstrates the accreditation for our accounts. We're 100% accredited for those clients that seek accreditation. We're very proud of our clients. 2 of them received special awards from the National Commission on Accreditation. One was awarded Program of the Year, and another one of our clients, Facility of the Year. We also have a number of our staff that are auditors for a variety of the accrediting bodies. In fact, we have 10 for Florida model jails alone. We're very proud of 2 of our staff that have been elected on the board of the National Commission on Correctional Health Services, and I myself am an elected ACA commissioner. But accreditation is just a basic foundation, really. It's what you build your health services program upon. You have to go above and beyond that. I'm going to ask Ken, please, to speak about our litigation, because I believe that's a true test of the quality of the services that you provide.
We've been very fortunate. My name again is Ken Palumbo. I am also an attorney as well as Chief Operating Officer. Over our 10 years, Armor's been blessed. I'm pleased to say that we have had 0 judgments against us in 10 years. Our litigation has been extremely low. It's something we pay attention to on a regular basis. We're not perfect, just like the best teaching hospitals in the country. We have had a few settlements. Those settlements break into 2 categories. First, if we've had a bad outcome and we've made a mistake, we quickly work with the parties to resolve that. Most of our resolutions have occurred prior to litigation having been filed. The second set of settlements we have is occasionally a client will come to us and say, hey, would you be willing to work this out so that we don't have bad publicity? And so we take a case that we would otherwise defend because we feel like our providers have provided proper care, and we will, for a modest amount, resolve that. So we've been very fortunate. We're not perfect. We're continually looking at every unintended outcome. We study those. We provide additional training where necessary, or resolution as appropriate. So for 10 years, we've had about 30 accounts, and we have averaged a little less than one settlement per account.
The RFP and answers to questions indicated that you don't have a fully functional electronic health record, and kudos to you for including that in this contract negotiation. We embrace electronic health records. We currently have 17 systems up and running. One actually is going live today, and the other is in the process. For us, converting from a paper record to an electronic health record is very painless. We make it painless for the staff, and it happens very quickly. It provides immediate access to pertinent patient information to our physicians and our providers to make those quality decisions that they need to make in a very quick amount of time as those patients rotate through the front door and back out again. A key measurement, though, of our quality care really is our client satisfaction. I'll ask Ken to speak to that, please.
A proverb that I like says that one should attack the weaknesses within rather than the weaknesses within others. And we take that to heart. Self-assessment, our mission, as Bruce said, is to provide quality patient care and to be fiscally responsible for the taxpayer funds that go through our hands as we provide that care. So we utilize self-assessment. Some of the ways that we do that is through surveys, or one of the ways we do this is through surveys. We survey our patients, we survey our clients, and we survey our employees on a regular basis. In fact, we just finished our most recent client survey, and you'll see on the slides, and we're proud of this, that a little over 97% said that in all the categories we meet or exceed expectations. And then 94% of our clients said that when compared to the providers who were there before them, and I don't mean to belittle those providers who were there before them, but they said that we were better than them. And the remaining 6% said we were as good as them. So we have room for improvement. We're constantly trying to be the very best that we can be. And so we use those surveys to see how we're doing and where we need to step up.
And a part of that, frankly, is we're sensitive to that. With Horizon being here almost 10 years, we're sensitive to correction. I mean, you get comfortable with it. We're very sensitive. We respect them. We compete against them. So we are sensitive to that, and even more so, respect to the employees that this is impacting right now. It's always a tumultuous time, and I can assure you that in regards to that, if we were selected, that we immediately would put them to rest to know that we're here to work with them. So, but the most important thing about that is they are the key to success, are the employees, period.
From a behavioral health standpoint, SMA is a huge asset to your community. Frankly, they're the nugget, the gold nugget. I highly respect their approach to patient care in both the mental health aspect as well as substance abuse needs throughout your community. So when we were developing the proposal, we were very excited to reach out and actually go to SMA and meet with Mr. Bell and Mr. Harvey and the SMA team to really develop a proposal where we could address not only cost savings, but quality effective care. And I think we did that in the proposal. The slide in front of you doesn't really do our behavioral health program justice, so I encourage further questions. However, it does highlight our commitment to safety, continuity of care, and the ongoing dedication to address the national crisis to decrease the amount of mentally ill offenders in both the jails and prison setting.
This slide just summarizes the staffing matrix that we place in our proposal. We built this from the ground up, if you will, specific to Volusia County. But because we're Florida-based, we're always benchmarking ourselves. Jails against jails that have a like size average daily population and patient makeup. We benchmarked against Brevard, Sarasota, and Manatee to make sure that this staffing matrix was on the mark. Our proposed staffing includes a little higher level of credentialing and skill set. We feel that's incredibly important, especially at the front door. We actually have master's prepared mental health professionals who are licensed to diagnose and actually Baker Act those patients as we focus on safety at the front door and throughout their stay in the jail. And the second area that we're very aggressive with is withdrawal and detox from alcohol and drugs. And so we really believe nursing at the front door is critical with that extra skill set above and beyond a paramedic level. If we somehow have missed our mark and we get in and work with you and with the jail staff and find that we've got to add some additional nursing hours or some additional mental health hours, that's on us. We add those hours, we never ever come back to a client hat in hand and ask for additional dollars. Because of that, our initial base price often is a little bit higher than some of our competitors, and we're very aware of that. But where we are able to make up in the total dollar amount of the package is with using a little higher credentialed staff, as we've got outlined here. We're able to do much more behind the wall, if you will, reduce transport to offsite, emergency room costs, and other specialty costs offsite. And I'll ask Bruce to speak a little bit more on that.
Before I move to that, I guess we want to try and walk the walk, not just talk it. I want to encourage you, for instance, in Santa Rosa, there was a tragic event in Escambia. Right now they're housing probably around 125, 130 of the Escambia folks in Santa Rosa. Look, it's our responsibility to take care of them. So as we sit here today, we're over our contract in regards to taking care of the folks, the additional population. We're not going to ask for reimbursement for that. If we're going to sit there and try and differentiate ourselves, that's our responsibility. So I would note that as well. As Angela indicated, I think it was talked about earlier, there's two components. There's the base compensation, and then there's a second component. It literally is the $1 million question, and that's off-site specialty services, or I think it's referred to as specialty services. This is where I frankly think that we make hay here. This is where, and you'll see 3 examples here, and we use these 3 particular examples. They're newer clients that literally the predecessor has been there for almost a decade. The first one is Lee County. Off-site services was $3.2 million the last year of the predecessor. We're on a run rate that's conservative. We will try and undersell and over-deliver. We're on a run rate of $2.6 million. Now, going to Angela's point, we're actually running about 2 to 3 employees over the contract. We don't ask for reimbursement for that. That's our responsibility. But the dividends that are paid to the county, and these are direct medical savings, nothing with security, nothing with transportation costs, I think is evident. There's a couple of statements there that validate that. The second one is Manatee County. Manatee County, we've been in there roughly 18 months. We just settled up the first year. They also have a specialty service line or an aggregate cap. The prior year before we came in, the total off-site services were a little over 1.2 million, and it's been that roughly for 4 years. Our first year, we averaged $433,000. We actually had $433,000. We rebated, and you'll see this momentarily, we rebated back to the county. We get that the hidden cost, if you will, how much you're going to run over that. We provide reports on a monthly basis. We're communicating with corrections constantly in regards to that, but that's a substantial savings in year 1. Santa Rosa, another great example. Predecessor had been there roughly 10 years. We've been there almost 5 years now, and again, we've averaged between $250,000 and $300,000 each year. I mean, these are millions of dollars. So we get that from a baseline perspective, that our costs might be higher, but when you aggregate everything together, I think you'll see that we are actually saving. Never forsaking quality, ever. These are just an example of true rebates. Again, 100% verifiable. You know, we have two marketing reps. We don't market a lot. What we try to do is sit there, do the job, and frankly, and hopefully down the road that you guys will be telling the same story that our other clients for us. But there's substantial dollars there, you know, and every account to us, Sumter County, it's a great story. First year there, you don't see the slide, but we saved like $700,000. That's a lot of money in regards to Miami County. So the proof's in the pudding. But really, this has come from a dollar-cent standpoint. This is what it gets down to. What we try to do, as Angela stated, we benchmark, we build everything from the ground up. Our first year, we proposed $7 million. The article, I think, over 5 years indicates $25 million. I'm not sure where that is, unless there's some type of, I don't like to use the word cushion, but the assumed cost for off-site utilization. And again, that being the case, I think we'll definitely do better than that. But the key is, what I want to point out to you, there's 2 items that we've assumed in our proposal that literally is modified. We noted them as far as clarifications we submitted in our proposal. One of them is referred to as the backfill vacancy differential. The way we interpreted it, and I think the answer to the question, is that every person has to be in a position every single day of the week. That's the way we interpreted it. I'm not saying that's the way it is, and the reason I'm saying that's not necessarily how it's enforced, is I don't think there's been any staffing withholds the last 3 years. But the way we interpret it is, we have to incur a substantial amount of cost that's frankly unusual. That's roughly $250,000. And the second one is associated with the umbrella component that I don't think is in the current contract. That's again, it's a $25 million umbrella. So those two items right there, it's $500,000 a year. Those two items, if modified, which would be very consistent with everywhere else we do, we could reduce our contract year one or our proposed price by $500,000. We actually did pretty good, I guess, in our time. We thank you very much. You know, God willing, we'll have the opportunity to work with you. But I can tell you, I hope that you see the passion. And we love what we do. We absolutely love what we do. We hope to get an opportunity to work with you guys. Thank you.
All right, thank you very much. All right, we will be kind of at ease here, off mic for the next 5 minutes while the next people set up. Or,
Taking questions together.
according to Ms. Jennings, the way they were going to go, each give their presentation, we'd be taking notes, and then we'd be able to ask them all questions when they all came back in. Okay, so I guess we're going to be in kind of a recess for the next 5 minutes.